I'm going to be doing a nose, mouth, and throat assessment on my patient here. So first we're going to look at her nose. We're just going to take a look at it first and see that she doesn't have any lesions or anything on the outside of her nose. We're going to look at her nares, and both of them are both symmetric and they are about the same width on the opening, and the septum is intact. And then we're just going to look into the nose and note if there's any lesions, bleeding, sores, or anything like that that needs to be checked out by a primary doctor. Everything looks pretty good to me. The color on the inside is even and the hairs are distributed evenly. So now we're going to palpate her sinuses, her cartilage, and the bone. Okay, did you have any tenderness with that? No, okay. So the bone was very hard, that's within normal limits, and the cartilage was spongy. We're going to check to see if my patient's nares are patent. Breathe in. Any difficulty breathing? Alright, we're going to be doing a mouth inspection on my patient here. So first we're going to take a look at her mouth on the outside. It is pink. She's got no lesions, no bumpiness. Have you had any concerns with your lips here recently? Okay. No. Take a look at her teeth. Any problems noted with your teeth recently? Okay. Can you stick out your tongue for me? Alright, it is pale in color. There's no film over it. It is symmetric in the shape, and it's not swollen. Is your tongue tender? There's no masses or cysts on there. Take a look at the bottom of her, under her tongue. There's no swelling, there's no masses, no nodules. The color's symmetric throughout. She does have some veins, but that's normal. We're going to take a look at the roof of her mouth. Alright, there's no swelling. The color's really good. The hard palate is hard, and then I'm going to have you say ah. Ah. The soft palate does raise whenever she says ah. Then we're going to take a look at the back of the throat. Can you ah? Okay. The uvula is within the midline. There's no swelling. The patient did have a tonsillectomy in the past. The retropharyngeal wall is smooth and it is pink in color. We're going to take a look at the patient's cheeks on the inside. Alright, looks good. There's no lesions, scar tissue, no masses. The color is pink and it is moist. We don't have a tongue blade to work with today. Normally I would take a tongue blade and check to see if the gag reflex is normal for the patient. So now today I'm just going to ask her. So has your gag reflex been normal? Okay. Alright, today we're going to be doing a breast assessment on my patient here. We're going to ask him to take his gown down. First we're going to inspect the breast and look at the color and look to see if each of the nipples are both symmetrical and round. We're going to look to see if there's any abnormal lesions that we can see just by looking at the patient. And then we're going to start doing a palpation of the lymph nodes. So what we would do is we would start down here and kind of feel under and around the armpit and down on both sides. And note that if there is any enlarged lymph nodes or masses, possibly cysts or anything like that. And then what we want to do is kind of go in circular motions around the patient and kind of massage to see if we can feel if there are any masses, and we would do that on both sides. And this needs to be done monthly for male and females. And then we want to check the nipple and kind of see if they both have the same texture, if there's any drainage at all. If there is drainage, you want to know the characteristics of it, the amount, the consistency, the color, and if there's any distinct smell to it that might be like purulent or infectious. So today I'm going to be teaching my patient how to do a breast self-examination. So every month you need to do the examination. You want to take the pads of your fingers and go in circles around the nipple outward. And you want to do this every month on both nipples, just like how I'm showing. And then you want to be feeling for any lumps or any discharge, any difference in color, if your breasts aren't symmetrical, and note if there's any changes in the characteristics of your breast. If any of these do come up, you want to make sure that you tell your doctor about it and follow up with your doctor to see if there's anything concerning.